Hello, our names are Dr. Sarah Grace and Dr. Janine Collins. We are pediatric ophthalmologists and strabismus specialists. We would like to talk to you about strabismus surgery or eye muscle surgery to straighten the position of the eyes. What is strabismus? Strabismus is when the eyes are not aligned. This usually happens because the brain cannot keep the eyes straight. In other cases, there is a problem with the eye muscle or the nerve that controls the eye muscle. There are different types of strabismus where the eyes can turn inward, drift outward, or float upward or downward. Strabismus surgery or eye muscle surgery is an operation on the muscles that are connected to the surface of the eye. The goal of strabismus surgery is to try to straighten or realign the eyes. There are 6 muscles that are connected to each eye, and they can be loosened, tightened, or moved to try to straighten the eyes. Strabismus surgery is performed by an ophthalmologist, a medical doctor who is an expert in medical and surgical care of the eye.
Strabismus surgery is done in an operating room, usually located in a hospital or surgery center. Strabismus surgery is done under anesthesia. Anesthesia is done so that the patient will not feel pain during the surgery. Anesthesia is given by a specialist in anesthesia. The type of anesthesia used for the surgery depends on the age and health of the patient. It also depends on the preferences of the patient and the ophthalmologist. Most children will be given general anesthesia for strabismus surgery. General anesthesia is when medication is given to the patient to put them to sleep for surgery so they do not feel pain. Adults may be given general or local anesthesia. Local anesthesia is when the patient is given medication that relaxes them during the surgery, but the patient is not fully asleep. The eye can then be numbed in several different ways so that the patient does not feel pain. Some of the ways include eye drops or injections of medication around the eye. Eating and drinking is limited on the night before and the morning of surgery so that anesthesia can be given safely. Instructions will be given before the surgery explaining what time to stop eating and drinking. If food or liquid is taken too close to the time of surgery, the surgery may be delayed or canceled. How long the surgery takes depends on the patient's health and the number of eye muscles that will be operated on. It also depends on if the patient has had eye surgery before. Most strabismus surgery is performed as an outpatient, meaning that it is usually not necessary to spend the night in the hospital after the surgery. After surgery, the patient will be monitored for a short period of time in the recovery area until the anesthesia wears off before being allowed to go home the same day.
You may have questions about how strabismus surgery is done. Let's walk through the steps together. During surgery, the eyelids are held open and the eye is turned to one side to allow the ophthalmologist to see the muscle being operated on. As shown in the picture on the left, the ophthalmologist will plan where to make a small cut, as shown by the black dashed line, in order to find the eye muscle. The location and size of the cut can vary. The ophthalmologist will then make a small cut in the thin, clear tissue that covers the muscle and will find the muscle to be adjusted, as seen in the picture on the right. There will not be any incisions made in the skin or into the eye itself. If the ophthalmologist wants to loosen or weaken the muscle, the ophthalmologist may attach small sutures or stitches to the eye muscle as shown in the picture on the left. The muscle is then partially taken off of the eye as shown in the middle picture. The muscle is then reattached to the eye further back from where it was first found as shown in the picture on the right. This loosens the muscle's pull on the eye. An eye muscle loosening procedure is called a recession. To strengthen or tighten an eye muscle, the ophthalmologist does a procedure called a resection or application. In a resection procedure, the ophthalmologist attaches the stitches to the eye muscle as shown in the picture on the left. Then a small piece of the muscle is removed as shown in the picture in the middle. The muscle is then reattached to the surface of the eye with stitches as shown in the picture on the right. In a plication procedure, instead of removing a piece of muscle, the muscle is folded and stitched together. Both a resection and a plication tighten the eye muscle and increase the muscle's pull on the eye. The ophthalmologist may discuss doing strabismus surgery with an adjustable suture if it is felt to be helpful to straighten the eyes. This type of surgery is performed in 2 steps. First, the ophthalmologist does a regular eye muscle surgery in which one or more eye muscles are weakened or tightened as described in the previous slides. Instead of tying a permanent knot in the stitches, the ophthalmologist will place a stitch that can be moved or adjusted at a later time. After the patient is woken up from anesthesia, the ophthalmologist will check the eye position and eye movements within a few hours to days after surgery. If needed, small changes in the position of the eye muscles can be made by moving the adjustable suture. This extra step can improve the success of the surgery and fine-tune the eye alignment. Adjustable suture surgery is not right for everyone. The goal of strabismus surgery is to make the eyes straighter. When the eyes are straight, they can work better together, and the patient can have better depth perception or 3D vision. Double vision will also lessen or go away when the eyes are straight. Most of the time, strabismus surgery is very safe. However, with any surgery, there are risks. The most common risk of strabismus surgery is that one surgery may not fully straighten the eyes. More than one surgery may be needed. Other risks include infection, bleeding, and loss of vision. Double vision can happen after surgery, but usually goes away on its own or can be treated with glasses or more surgery. Anesthesia for eye muscle surgery is also safe for most people. The risk of anesthesia depends on the health of the patient and family history of anesthesia reactions. Make sure to discuss the risks and benefits of eye muscle surgery with an ophthalmologist. It is normal to be nervous about strabismus surgery, and there are some myths about the surgery. First, the eye is not taken out of the eye socket during surgery. The eye is gently moved from side to side to perform the surgery. Second, laser, while used in other types of eye surgery, is not used in strabismus surgery. Finally, the operation is done on the outside of the eye itself and not on the skin, so there are no cuts or scars on the skin after the surgery.
After strabismus surgery, it is common to have some eye pain. The eyes may look red, swollen, or watery. The eyes may feel sensitive to light, itchy, scratchy, or sore. There may be some pink tears after surgery as well. These problems usually get better after a few days. Eye redness can last a few weeks or a few months. Usually the stitches dissolve on their own and do not need to be taken out after surgery. After strabismus surgery, appointments will be scheduled to check on how the eye is healing and on the success of the surgery. Acetaminophen, known as Tylenol, or ibuprofen, known as Motrin, can be used as needed to treat soreness after strabismus surgery. Stronger pain medications are usually not needed. Many ophthalmologists give eye drops or ointment after eye muscle surgery. These medications may have antibiotics, steroids, or both. Directions for any medications needed after the surgery will be given by the ophthalmologist. Most of the time, the patient will not need to wear an eye patch after surgery. A patch may be needed after an adjustable suture procedure or if local anesthesia was used for eye muscle surgery. If a patch is placed, the ophthalmologist will explain when it can be removed. What things should you be worried about after strabismus surgery? While uncommon, contact the ophthalmologist right away if any of the following things happen after surgery. If there is bad eye pain that does not get better with acetaminophen, known as Tylenol, or ibuprofen, known as Motrin. If the eye is unable to move in a certain direction or is stuck in one position. If the vision is much worse or getting blurry very quickly, or if the eye swelling or redness seems to worsen after surgery. Double vision can be a normal part of the healing process from strabismus surgery. It usually improves slowly over days to weeks after the surgery. After strabismus surgery, glasses may be needed to help with vision or double vision or to help straighten the eyes. There are a few activities to be careful of for a few weeks after strabismus surgery. During the healing process, it is best to stay away from activities that may cause the patient to strain. Adults should limit exercise to light cardio and not lift heavy weights. Children should not play contact sports or jump on trampolines. Actions that could cause something to get in the eyes may cause an infection and should be avoided as well. These activities include eye rubbing, getting soap or water in the eyes, playing in a sandbox, mowing the lawn, or swimming. Limiting activity can help keep the eyes safe while healing from surgery. It is safe to use the eyes for calm activities after eye muscle surgery, such as reading, watching TV, and traveling. After strabismus surgery, children often feel back to normal within a few days and can return to school or daycare. Adults can drive and return to work when they feel comfortable, but may want to speak to their ophthalmologist first if they have double vision. Some people need extra time to heal from surgery. Any worries about the healing process should be discussed with the ophthalmologist who does the eye muscle surgery. In summary, strabismus surgery is an operation on the eye muscles to help straighten the eyes. Overall, this procedure is safe and successful, but has risks just like any surgery. Any questions about strabismus surgery and if it is the right treatment should be discussed with an ophthalmologist. Additional information about strabismus and strabismus surgery, as well as other eye conditions, can be found on aapos.org.